Welcome to another deep dive, and a special welcome to you, the listener, who I like to think of as the ultimate learner. We are so glad you're here.
Absolutely. I'm really excited to dig into the stack of sources we have today. It's quite a stack.
It really is. Today's deep dive mission is going into the rapidly growing and honestly sometimes controversial world of energy-based vaginal tightening, or, as it's heavily marketed, rejuvenation.
Right. And specifically, we're looking at how this massive wellness trend collides head-on with one of the most common viruses on the planet, which is HPV.
Exactly. We've got a really comprehensive stack of sources to pull from today. We're talking FDA safety communications, clinical studies on laser and radio frequency devices, official clinical guidelines from gynecological societies, and even specific clinic FAQs.
Yeah, we are pulling from all sides to get a balanced view of what's really happening in these clinics.
And the core question we want to answer for you today, because this is highly relevant if you're even considering one of these procedures, is this. If 8 out of 10 of us will contract HPV in our lifetimes, how does this incredibly common virus affect your eligibility for these super heavily marketed intimate treatments?
It's a huge bottleneck. I mean, the friction between commercial wellness and fundamental virology here is just staggering.
Okay, let's unpack this. Before we can understand why a virus would disqualify you from a treatment, we have to understand what the treatment is physically doing to the tissue.
Yeah.
So, what exactly are these energy-based devices actually doing to the body?
Well, let's strip away all the rejuvenation marketing speak first, because biologically what we are talking about here is controlled thermal injury.
Controlled injury.
Exactly. Clinics are using what we call energy-based devices, or EBDs. Specifically, the sources mention fractional CO2 lasers, erbium YE lasers, and radio frequency, or RF devices.
Okay, so lasers and radio currents.
Right, and they deliver this highly controlled thermal injury heat, essentially to the vaginal walls.
And what does heating the tissue actually achieve? Because it sounds like you're just, burning the tissue and hoping for the best.
It sounds counterintuitive, right?
Yeah.
But it triggers a biological process called neocollagenesis. That just means new collagen production. When you heat the dermal layer to precisely, say, 40 to 45 degrees Celsius,
Which is pretty hot.
it is. The existing collagen fibers physically shrink and unravel, and this sudden thermal stress triggers heat shock proteins. They act as cellular first responders, signaling fibroblasts to rush to the area and build brand new, tighter networks of collagen.
So it improves elasticity, blood flow, moisture, all that stuff.
Yes. Medically, it shows promise for treating genitourinary syndrome of menopause, or GSM, which causes severe dryness. Also, laxity after childbirth, and even mild urinary incontinence.
Okay, so it's essentially like aerating a lawn. You cause tiny controlled damage so the tissue rebuilds stronger and thicker.
That is the perfect analogy, actually. You punch tiny holes, and the lawn grows back thicker.
But, and this is the elephant in the room from our sources, the FDA has issued a really stark warning about this, haven't they?
They absolutely have.
Mm.
If we connect this to the bigger picture, the FDA is pushing back really hard on the aggressive cosmetic marketing of these devices.
Because they aren't actually FDA approved for rejuvenation, right?
Correct. Vaginal rejuvenation is an ill-defined cosmetic term. It's marketing. The FDA states that the safety and efficacy of these devices for that specific cosmetic purpose has not been established.
And the sources point to the MAUD database, right? That's the FDA's database for medical device reports.
Yeah, the Manufacturer and User Facility Device Experience database.
Mm.
And the reports there are pretty grim.
Yeah, I was reading through the source material, and they report severe complications. We're talking vaginal burns, permanent scarring, recurring pain during intercourse.
Exactly. The FDA cleared these lasers for cutting and destroying abnormal cervical tissue and warts in a medical setting, not for broad anti-aging tissue remodeling across, healthier menopausal tissue.
Wow. Okay, so knowing the FDA has these major concerns about safety, legitimate clinics obviously have to put strict medical gates in place before allowing anyone to just, hop on the table for these procedures.
They have to. The liability is massive otherwise.
And the biggest gate, according to the clinical guidelines in our stack, is cervical screening and HPV status.
It is the absolute determining factor for patient eligibility.
But this is where the math gets really confusing to me. Our sources note that high-risk HPV is passed through basic skin-to-skin contact, right?
Right. Very easily transmitted.
And roughly 8 in 10 people will get it at some point. So wait, if 80% of us get this, aren't clinics disqualifying almost everyone from getting these treatments? I mean, how do they stay in business?
It's a great question. But there's a crucial distinction here between having had HPV in the past
Mm.
and having an active infection or actively abnormal cells right now.
Ah, okay. So past exposure isn't a deal breaker.
No, not usually. When most people get HPV, their immune system recognizes the viral proteins and mounts a defense. It usually clears the virus entirely within about 1 to 2 years.
And you might not even know you had it.
Exactly. So clinics require a normal pap smear, usually within the last 1 to 3 years, depending on your local health guidelines, and absolutely no active genital infections.
Right. So they're looking for an all clear right now.
Right. You aren't banned for life if you've had HPV. You are just paused until your immune system clears it, or until any abnormal cells are medically treated.
Okay, that makes sense. So why exactly does an active HPV infection hit the brakes so hard on a laser or radiofrequency treatment? Like what happens when energy devices meet viral DNA?
Well, applying extreme heat or radiofrequency to active viral lesions can drastically exacerbate the issue.
The clinic policies we looked at, like the FAQs for Thermiva and similar devices, they list active HPV, like genital warts or HSV herpes, as strict contraindications. Hard stops.
And there is a very sound biological reason for that.
They did note that low-risk HPV might sometimes be treatable under certain conditions, but high-risk HPV or an abnormal PAP means the patient has to be managed medically first.
Right, because if you have unresolved abnormal PAPs, what we call CIN, or cervical intraepithelial neoplasia, you need medical focus on cancer prevention, not, cosmetic tissue remodeling.
So it's like trying to remodel a kitchen while the house is on fire. You have to put the fire out, clear the active infection or the abnormal precancerous cells before you start doing cosmetic or structural upgrades.
I love that analogy.
Yeah.
You definitely don't put down new countertops while the cabinets are burning. What's fascinating here is that lasers are actually used medically to destroy HPV warts.
Right. I saw that in the sources and it really confused me. Doctors use lasers to kill the virus, but cosmetic clinics say you can't use a laser if you have the virus.
It comes down to how the laser is used. When a doctor uses a laser to destroy a wart, they use a continuous high-power beam aimed directly at the lesion to instantly vaporize it.
A targeted strike.
Exactly. But for general tightening, they use a fractional setting. It splits the beam into hundreds of tiny microscopic dots scattered across the tissue. It leaves wide bridges of completely untouched tissue in between to speed up healing.
Oh, I see. So it's not vaporizing the whole area.
No. So if you have an active infection and you use a fractional laser, you're basically punching thousands of tiny entry wounds into the mucosal barrier.
You're giving the virus a free pass into the deeper tissue.
Yes. You are handing the viral particles direct access to the basal cells they need to hijack and replicate. It increases the spread of the infection to surrounding tissues. It creates a totally different risk profile.
That is terrifying.
Yeah.
You walk in for a cosmetic tune-up and walk out having spread a viral infection deeper into your own body.
It is a massive risk. And if the patient has those precancerous CIN changes, the laser is stimulating extreme blood flow and cell division in an area where cells are already behaving abnormally. You're throwing fuel on a precancerous fire.
Okay, so that perfectly explains why it's so dangerous for the patient. But the danger of mixing lasers with active HPV isn't just about the virus spreading within the patient, is it?
No, not at all.
There is a bizarre and frankly terrifying risk to the person actually holding the laser.
The occupational hazard is immense.
Here's where it gets really interesting. The sources dive into this concept of laser plume or surgical smoke. Can you explain what that is?
Sure. When ablative lasers or electrocautery devices hit a human cell, they superheat the water inside the cell almost instantly. The water turns to steam, expands, and literally blows the cell membrane apart.
Just microscopic explosions.
Right. And all that cellular debris, the proteins, lipids, and whatever else was in the cell, gets propelled into the air as a visible plume of smoke.
And for a long time, doctors just assumed the laser was so hot it incinerated everything, right? Like the smoke was harmless.
That was the assumption for decades. But we now have conclusive data showing that when you vaporize HPV-infected tissue, the resulting smoke contains viable, living HPV DNA.
Living virus in the smoke.
Yes. Our sources highlight a systematic review showing that HPV DNA was detected in the surgical plume in 62% of ablative laser procedures.
Wait, so the laser doesn't instantly incinerate the virus? The doctor is literally breathing in aerosolized HPV.
Exactly. The viral DNA survives the heat, hitches a ride on the water vapor and particulate matter and drifts right up into the air.
That is unbelievable, and they're just breathing it in.
They are, and the medical literature from our sources documents the tragic consequences of this. Gynecologists, dermatologists, and operating room nurses who inhaled this plume for years have developed HPV-positive or pharyngeal cancers.
Throat cancer.
Yeah, throat cancer. And something called laryngeal papillomatosis, which is basically aggressive warts growing on their vocal cords and inside their airways.
Oh my God, just from doing their jobs.
Just from doing their daily jobs without adequate respiratory protection. This raises an important question about occupational safety. Standard surgical masks, the paper ones, do absolutely nothing to stop particles this small.
So what do? How do clinics protect their staff?
This is why there's a strong push in the medical community for all providers performing these ablative procedures to get vaccinated with the Gardasil 9 HPV vaccine.
Oh, wow. So it's not just a vaccine for teenagers anymore. It's essentially personal protective equipment for doctors.
Exactly, it's occupational armor. And clinics also need to invest in specialized smoke evacuators, basically powerful vacuums right next to the laser tip. And providers need to wear highly fitted N95 masks.
And obviously, this is exactly why clinics absolutely do not want to use cosmetic tightening lasers on a patient with an active viral shedding HPV infection.
Exactly. It is a dual protection protocol.
It makes total sense now. Okay, so if we zoom out and look at this whole landscape, energy-based vaginal treatments offer some genuinely intriguing benefits for tissue elasticity and moisture, especially for postpartum and menopausal women. But they come with serious FDA warnings.
Very serious warnings that shouldn't be ignored.
And when it says HPV, while a past cleared infection won't disqualify you, an active infection or an abnormal pap smear is a hard, non-negotiable stop.
Right. It protects you, the patient, from inadvertently spreading the virus deeper into your own tissue or feeding precancerous cells.
And crucially, it protects the doctor and the clinic staff from literally inhaling infectious, cancer-causing smoke.
Which is a reality most people never even think about when they book a cosmetic appointment.
It really isn't. And you know, this whole deep dive really reminds us why standard medical screenings, like pap smears, are so incredibly vital. We tend to think of them just as, basic cancer prevention checkpoint.
Right, something you just had to get over with.
Yeah, but they dictate your eligibility for modern wellness and quality of life treatments. You can't safely access these advanced therapies without knowing your exact baseline health.
You really can't. And I think there's a broader philosophical point here, too. As we invent more and more powerful energy devices to reverse aging or modify our tissues, whether it's lasers, radiofrequency ultrasound, we have to wonder.
Wonder what?
Well, how many other hidden microscopic ecosystems, like our natural microbiome, are we inadvertently vaporizing, altering, and breathing back in? We focus so much on the visible, microscopic results, but there's an entire invisible world we are disrupting with every pulse of that laser.
That is a wild thought to leave on. Thank you for walking us through all this complex science today. And to you, the learner, thank you for joining us on another deep dive. We'll catch you next time.